let's just take a very quick look at some of the burdens that we've then placed upon our correctional facilities. We have transition planning, which I think we've established, or you guys have established, is not adequate. So if you don't have adequate transition, how does that compromise public safety? Let's start with that. Does it?
Yeah, well, I've mentioned released. I think what is important is to have reintegration centers. Individual is released from prison, then goes to the reintegration center, and at that point, the proper follow-up is arranged. The patient, unfortunately, these conditions are lifelong. They don't go away. There's going to be a need to have follow-up for the individuals the rest of their lives.
And we have homelessness, you mentioned that. We have suicide by cop or otherwise, right? And then someone here mentioned the relapse into substance abuse. That's a complex relationship.
Well, the majority of individuals with serious mental illness also suffer substance abuse. More than 50%.
Which leads to many of their arrests, because it's a way to fund their substance abuse.
I get
Which
it.
can contribute to violence as well.
Absolutely.
Right.
Absolutely.
And the
Most
violence
common
goes up
contributor.
when they're on substances.
Yes.
75% of people in jails with serious mental illnesses have a co-occurring disorder, meaning they both have mental health and substance use addiction. And we have to treat both, and we don't, and that's also part of the problem. But you know, the good news is it's fixable. And it's not just about having reentry. You need a multiple approach to this. I say a three-part approach. You need to start early in the school systems and with the pediatric systems to start identifying and screening for trauma. You then have to have a really elaborate pre-arrest system so that people don't come into our system and they go to a crisis care center before they get arrested. And then when they do penetrate the criminal justice system, you have to have a quick system of diversion. If you get arrested in Miami now on a misdemeanor and you're identified as having one of these serious mental illnesses, within 3 days we have you out of the jail, we send you to one of these crisis systems. Because they're on a correctional hold, the 72 hours of our involuntary law does not apply. We reset the case for 2 weeks, which is what they really need. They don't need long-term hospitalization, but they need some decent hospitalization. And then we offer them an opportunity when they come out to get housing, benefits, medication, clothes, food. We have peers that work with them, have graduated our program, that help them reestablish relationships, and then help them go back into the community.
There is a phrase, right? APIC. What is APIC? It's for transition.
Well, we're talking about that. You're assessing the needs before the individual.
Assess.
Yes.
What else? There's P, the plan. How does that work?
You're planning for their release into the community. So you identify individuals in the community that can meet those needs. Right. Yeah.
But even in the plan, before they get released, what we do is we do a psychosocial, we do a Texas Christian University drug screening evaluation, and we do something called ORIS, which is an Ohio risk assessment to look at their criminogenic risk factors. Look, the ridiculous part of mental illness is that we don't always find the right treatment for the right person. You know, it's one shoe fits all. And so you really need to plan properly and figure out what the person needs before they even leave our system.
Now, the C in APIC is coordination, and that's what I keep hearing is maybe the biggest. We've gotten the assessment, the plan, identifying the required services, but then somebody's got to step in and coordinate. That's the C in APIC, right?
And what we use to help do that are peer specialists. Those are people with serious mental illnesses that are in recovery, that have graduated from our program, and that help this individual navigate these complex systems of care out there.
The problem with jails especially, though, is that you never know when a person is going to leave a jail, because they could be bonded out, the sentence could be, adjudicated, and so the planning is very difficult. So it's important to note for correctional facilities, you have to start planning at that first moment of encounter with the individual. And so that's one of the guiding principles that, most correctional institutions should have.
Chicago does this incredibly well, but most jails don't even do a very good job of assessing the person's illness or diagnosing it at the point of entry. So all the assessment tools need to be redone. They need to be validated tools. They're not doing that. A lot of work needs to be done.
I hear that your area, what I'm hearing you say is that APIC is part of what you've started doing.
Absolutely.
And your experience is that it works?
Let me tell you something. I already told you that our number of arrests dropped from 118,056 Recidivism rates among our misdemeanor population went from 72% to 20%, and our felony diversion program has a recidivism rate of about 20-something%. It saved the county 68 years of jail bed days.
68 years?
Yeah, treatment works.
Okay.
And coordination works, and helping people get their lives back is the right, appropriate thing to do.
And contribute back to society.
And contribute, and it improves public safety. It saves money, improves our public safety, and it helps people get their lives back. There's no reason not to do
I'm
this.
going to save my last question for just a moment. The association between adherence to antipsychotic medication and reincarceration, I'm going to assume there's an association, yes?
Well, there often is, because what happens when you're not taking your medication? Unfortunately, you have a disease that is very chronic. You get an exacerbation of your illness, and when you start hearing voices, you don't say, oh, I better get back on my medicine. These patients, what they start using is drugs and alcohol. The combination is a significant increased risk for aggressive or violent behavior, or not being able to function to the way they should in the community, and they end up back into the correctional
You
facility.
know, there was a book recently from a rock star, and the title was, Are the Voices in My Head Bothering You? And the answer seems to be, yeah, they are, because the behavior that they induce bothers society. You need to treat it, right? Is that fair?
Well, absolutely. And it creates a significant amount of anxiety, right? For patients, we don't even get them to verbalize, and as they're more fearful, they become greater risk.
So there was a study a couple years ago at the University of California, and they looked at the voices culturally. They went around the world, and what they found is voices for people with schizophrenia in the United States are more violent. So in Africa, the voices they hear actually are calmer and quieter. And so there is some cultural issues about our society that affect this issue and probably speaks poor volumes about us, but it is an issue.
Okay, I want to ask